mic is on. Welcome everyone to the fourth session of our webinar series, themed Infrastructure and Equipment, brought to you by Africa Health Business. My name is Christine Hogendoorn and I'm the Business Development Manager at AHP. Before I introduce you to today's moderator and we start the webinar, I would like to take you through some housekeeping rules. First, attendees will be on mute during this session. Please note that you can post your questions in the Q&A section on your screen. Your typed questions will be responded to as much as possible. This is a 90 minutes event. Please observe the allocated time during this session. And lastly, this webinar will be held in English. If you would like to listen to the French translation, please click on the translation button on your screen and don't forget to mute the original audio. I would also like to take this opportunity to show you a couple of short videos from our event partners who have contributed to this event. The first video is from LENMED and the second one is from SAP. We're happy that you're here and a very warm welcome to both of you.
Pediatric cardiothoracic surgeon. Pediatric endocrinologist.
There's one hospital where your child will receive more specialist care than in any other private facility in South Africa.
Gene surgeon. Pediatric genetics.
The Pediatric Center at LENMED eThekwini Hospital and Heart Center. You don't need to know what their titles mean to know how much it means for your son or daughter.
pediatric pulmonologist.
Len Meditequini Hospital and Heart Center. Your child deserves the best.
Here you see the agenda for today's event on infrastructure and equipment. I would like to reiterate that this is a 90-minute session. And now it's my great pleasure to introduce you to the moderator for today's webinar, Claire Omatsei, MD at JNC International and Director at the Africa Healthcare Federation. Welcome, Claire, and enjoy the webinar.
Thank you for that introduction and those lovely videos. I'd like to first, of course, welcome our delegates and our panelists today to this very important session of the African Health Business Symposium, the Partnerships for COVID-19 webinar series. This is the fifth thematic series since it started. And I think that this is going to be the most interesting on infrastructure and equipment, because what can you do with COVID-19 without this? To get the ball rolling, I'd just like to give a little bit of a background as to why this session is so important before I go on to introduce our speakers. I'm sure you all agree with me that we're in really, truly unprecedented times for families, for cities, for countries, and for continents. In Africa, we haven't been left out. We have actually been hit pretty hard because we have, in addition to the fact that we have this pandemic, an already overburdened healthcare systems, very high out-of-pocket payments, where people unfortunately become quite impoverished when they were trying to access healthcare, poor infrastructure, a poor referral system, an increase in medical tourism for those that can, and unfortunately of recent, also a massive brain drain where we're losing our best and brightest to other developed countries, such that we have a very poor patient or nurse doctor ratio with more than 1,000 patients per doctor or nurse across Africa. You see, there's statistics that we know that I don't like to share, but I'll mention one. And that is that 3% of our healthcare workforce in Africa is actually serving over 15% of the global population. It's therefore very important that we look after our healthcare practitioners. And that means we need to be able to have access to good quality care, good PPEs to protect them and look after them, create an enabling environment with the right kind of infrastructure. And this can only happen with proper public-private partnerships. Now, as you can see, the African Health Business Symposia has always put together the importance of strategic partnerships, and that governments cannot do this alone. And we have seen in COVID-19 pandemic, that collaboration between the public and the private sector, and how truly, with the brightest minds, with innovation, with out-of-box thinking, that we can make a difference. And today we're going to listen to some really incredible speakers who in their own fields have been able to make an impact through innovative thinking, innovative products and services, and start to provide quality, access to quality healthcare for Africans across the continent. I think that it is important that we start to think about having some self-sufficiency. The fact that Africa is import dependent, I'm sure that with some of the speakers today, we're going to look at how those partnerships can also lead to having production on the continent, better value for money, more transparent procurement processes, and how those multinationals that are used to the best practices can make sure that we in Africa get access to quality care. So to get the ball rolling, we have our first speaker today, who is our keynote speaker, and his by person of Professor Babatunde Obilola. Professor Obilola leads the Public Health Security and Nutrition Division of the African Development Bank. Before I introduce him properly, I'd like to let everybody know that currently he's managing a $10 billion COVID-19 crisis response facility. So when you hear him speak, he understands the power of access to finance and how this can galvanize change in infrastructure and access to quality healthcare. He has been supporting several African countries through private enterprises in the responses to social, economic, and health impacts in the pandemic. He's a developmental economist and international development expert. He has received several international awards, including a fellowship internationally for the Comparative Research Program in Preventing and Eradicating Poverty. Ladies and gentlemen, I now introduce to you Professor Babatunde Obilola. Please go ahead with your presentation.
Thank you so much, Madam. Thank you so much for that generous introduction. I'm very delighted to be here to join this conversation. And I would like to thank the African Health Business Symposium, Federation, for giving this platform for me to be able to share some of what we are doing at the African Development Bank to respond to COVID-19, particularly in terms of opportunities for countries on the continent to be able to ramp up their health infrastructure. Let me begin by saying that we're witnessing a very terrible pandemic in our history, a pandemic that has caused almost 709,000 deaths around the world. What we know right now, as at this morning, from the World Health Organization, is that we actually have about 19 million confirmed cases of COVID-19 around the world. So which means we are facing a really, really daunting challenge in everything that we're doing. So in terms of what we also know, we may not have reached the apex of this pandemic. And we have seen so far from other countries that for Africa, this is a ticking time bomb for us. Because if advanced economies like the United States, Spain, and the rest of them, if they have been so struggling to contain the wrath of the pandemic, then it definitely has a devastating potential in poor countries in Africa, where, of course, when you look at our lifestyle, you look at our culture, our beliefs, and also the economic conditions that we have in place in many of our countries, they actually offer fertile grounds for disease such as COVID-19 to thrive. So we have to make sure that we really ramp up our infrastructure. Let me perhaps give some statistics in terms of where we are coming from. At present, Africa is home to about 1.3 billion people, which we all know quite well. And Africa bears 1/3 of the global disease burden. Yet, Africa accounts for only 3% of the global health workforce. The average physician density in sub-Saharan Africa stands at around two doctors per 10,000 people. This ranges from around 0.6 in Burkina Faso to 9 doctors in South Africa. So which means we really have a huge health infrastructure gap on the continent. And because we do have these terrible health infrastructure gap on the continent, it means that we need to focus a lot on how to really build our health care infrastructure and equipment on the continent. So for us at the African Development Bank, what we are really focusing on when it comes to the health sector is really to focus more on the health infrastructure side of health in a way to really support many African countries in terms of healthcare workforce, in terms of equipment that countries need, in terms of dispensaries, health centers, which are limited in supply in many African countries. We are also supporting African countries in terms of laboratory capacity in most African countries to really strengthen them and to support provision of all kinds of equipment that are needed, whether equipment such as ventilators or masks or many others, including, of course, helping countries to come up with their ICU beds, intensive care unit beds that are really limited in many African countries. It will surprise you that a country as advanced as South Africa, with all its advanced public health systems, has less than 1,000 ICU beds. In Malawi, 17 million people rely only on 25 ICU beds. Countries like Zimbabwe and Liberia have none, basically, in terms of ICU beds to really take care of patients that require such services. So now, in terms of the graph that we are looking at, let me mention that what we know is that just a little over half of all African countries have personal protection equipment available and accessible to healthcare workers. And there are fewer than 2,000 working ventilators in public hospitals across 41 African countries, compared with more than 170,000 in the United States. There are 5 ICU beds per 1 million people in Africa, compared with 4,000 beds per 1 million people in Europe. So all of these statistics we know quite well. So now let me really tell you what we are doing at the African Development Bank. The board of the African Development Bank, when this pandemic started and when it was declared a pandemic by the World Health Organization, the board of the African Development Bank basically approved a $10 billion COVID-19 crisis response facility. From this particular $10 billion COVID-19 crisis response facility, the bank earmarked $5.5 billion to support our middle income countries, countries that are really advanced on the continent in terms of income, so that they be able to really ramp up their healthcare infrastructure. And then the bank devoted $3.1 billion to support our low-income countries and countries in fragile situation across the continent. And then we devoted $1.4 billion to support private enterprises in terms of manufacturing of equipment, in terms of infrastructure, but also in terms of procurement of the medical needs that are really urgently needed in many African countries. In addition to all of those resources that we provided, the $10 billion, the bank also earmarked a separate amount of money, around $115 million, to basically support regional economic communities throughout the continent in terms of cross-border support to deal with the crisis, but also in terms of procurement of medical needs and medical equipment that countries require under those regional economic communities. And those resources, definitely, we made them available to Central Africa through CEMAC, to the G5 Sahel, to ECOWAS for West Africa, to SADC for the Southern African region, and also to East African community, as well as IGAD for East African countries. We are also in the process of extending $27 million grant to the African Union Commission through the African Centers for Disease Control and Prevention, so that they can also get involved and make available all necessary medical equipment and infrastructure needed to support the response to this crisis on the continent, and also to do more about capacity building across the continent. In terms of also one of the things that we have done as a bank, we made available a $3 billion social bond to basically support our African countries to lessen the impact, the social and economic impact of this crisis in many African countries. At the time that we launched the $3 billion COVID-19 social bond, it was the highest on the global market at that time. So basically, in terms of what we do for countries, when we extend resources to them, we focus on 3 different things. The first aspect is really to help countries to be able to deal with their health infrastructure and equipment, to be able to supply the medical needs that are urgently needed in terms of dealing with the health impact of the crisis. The second thing is to provide liquidity for governments so that they can take care of their citizens, they can have access to resources to pay salaries, but also to take care of small and medium enterprises and to deal, you look at the continent of Africa, where about 85 or 86% of Africans that are working in the informal sector. So part of our resources have been going to support those in the informal sector so as to improve their productivity and to help a lot of African countries to be able to reopen safely after the lockdown. The third component of our resources, basically for countries, goes into supporting and protecting the poor and the vulnerable in terms of social protection coverage in different African countries. So this is how we have been operating so far. But in addition to all of this support, we decided at the bank, at the level of the president of the bank, to really come up with a very comprehensive health infrastructure strategy for the African Development Bank in a way that we'll be able to look at what are the key ingredients that would make African countries to ramp up their health infrastructure and equipment, but also to be able to build public and private partnerships for earth infrastructure on the continent. So we are working now on this earth infrastructure strategy, which will be ready by the end of the year. And we really would like to engage more of our partners in this particular earth infrastructure strategy, which for us as a bank is really needed for the for African countries and for the African continent. So this is what we have been doing. So we believe that we need to really work together and focus on some aspects of what we are currently witnessing in terms of the COVID-19 response. And this is our challenge number 2. This is in terms of limited testing and diagnostic capacity. The president of the African Development Bank has basically put together a committee to look at how can we ensure that we have more testing, we do more diagnostic, we improve diagnostic capacity for COVID-19 testing across the continent. Because as we know right now, the average number of tests per 1 million people on the continent is less than 7,000 compared to around 243,000 in the United Kingdom, or 181,000 in the United States, or 96,000 in Germany. So that's another area where we would also be looking forward to working with all of our partners to be able to ramp up limited testing and diagnostic capacity on the continent. Let me conclude by saying that investing in quality earth infrastructure makes sense, both economic and social perspectives angle. It makes sense from both angles, whether we really want to have economic development on the continent. I am a development economist, for instance, and in all my work, I have seen that without quality earth infrastructure, it's impossible to really generate the kind of economic development that Africa requires. And we also know that enough evidence has shown us that investment in earth infrastructure creates an avenue for resilient societies and drive inclusive growth. And that is why we believe that development partners, private sector enterprises have a role to play in terms of ensuring that we have quality earth infrastructure on the continent of Africa. We can all work together to prevent the collapse of earth systems in Africa by establishing, for instance, special funding schemes to support the earth expenditures of many African countries, which must be targeted and well-defined. We also have to work together to ensure that we avoid overstretching existing earth infrastructure on the continent while strengthening human resource capacity in the earth sector on the continent. And we already know there are a lot of breakthrough innovations that are ongoing across the continent, whether it's in area of telemedicine or the use of drones, as we have seen in Rwanda. And so we need to support many of such breakthrough innovations. And that's what we are doing at the African Development Bank. And we'll continue to work with all of you to really ensure that we support we support more investment in the area of quality earth infrastructure, in helping to equip our medical centers with modern facilities. And we believe that the time is now. We need to use the opportunity of this crisis to really ramp up our earth infrastructure on the continent. And from us, from the African Development Bank, we look forward to working with all of you in this area. Thank you so much.
Thank you, Professor Milola. That was an incredible, lots of take-homes from there, but most importantly, the dedication of the bank, your management, your board, with this huge fund of $10 billion that you are investing in Africa. On behalf of the African continent, we say a very big thank you to you. In your words, the time is now. We need to use the opportunity of this crisis to be able to make a difference. And you also said that healthcare infrastructure makes sense and it's important for both economic and social development. We have a lot of questions for you, but we will take them at the end. So we'll now move on to our next speaker. Our next speaker is a very special person. He is the CEO and president of General Electric, who has a career spanning over 28 years, Mr. Farid Fezua. Farid has been in development in Africa, I think, since 2012. He has led several major large-scale modernization projects and programs, and also in public and private development partnerships across Africa. He has an extensive experience in financing of trade and investment flows across the Middle East and Africa. And we cannot today think about COVID-19 and you don't think about the healthcare infrastructure and the tools to which our doctors and nurses are working with. I think everybody is very well aware about the word ventilator, about CPAP machines. And without the provision of these very important machines, and most importantly, that public-private partnership, we wouldn't be where we are today. So let's listen to the president and CEO of General Electric, Mr. Farid Fazua, as he takes us through what GE has been doing in the fight against COVID-19.
Thanks, Claire. And first of all, let me thank you personally and thank the African Health Business Association for having me today and share the experience, I would say, of GE in Africa within COVID. I would like also to echo what Babatunde just said about the belief that healthcare infrastructure, and particularly planning right, sustainable healthcare infrastructure, can really bring the responses that help us face the likes of the pandemic we've seen on COVID-19 over the past months. First of all, the COVID-19 came at a time when we had just adopted a new purpose statement at GE. And that new purpose statement is, we rise to the challenge of building a world that works. And I couldn't think of a better test time than COVID-19 to really test the company on this purpose. And whether it's going through ensuring that healthcare is delivered in a timely manner, whether it's ensuring that the light stays on in hospitals and homes, with our power generating business and distributing business, as well as our aviation business. We like to think that aviation came to a standstill. Actually, a lot of the emergency COVID actions had to be done by air. And here we were there to support as well our customers. I would start first to what COVID meant for us, and particularly in Africa, globally, but specifically in Africa. We had to adapt fast to establish new safety protocols. I think just like a lot of you and a lot of companies across the world, our number one priority is truly the health and safety of our employees and customers. And I would say in this regard, COVID was truly a huge challenge, providing EHS protocols for our employees and customers, making sure that, when we go at site, we have our frontliners. We've been talking about the clinical frontliners and nurses and doctors in hospitals, but when it comes to an equipment, an infrastructure company like us, it's every day our field engineers going in the front line, our clinical application staff supporting the nurses, the doctors in ICU rooms every day. And we had to ensure that the protocols on safety were respected all through, from our own employees and at site with our customers. It also has been about establishing very strong crisis management plan. We are all challenged by the speed of the spread of the COVID-19. And in that regard, being able to follow strict crisis management rules, as well as being proactive on actions, because the situation developed and evolved very rapidly, was also very key. So that was a big learning for us as well, even for a company that has been in the lead, I would say, with regards to safety and safety protocols. The second priority has been about being there for our customers. And customers means hospital, healthcare providers, both private hospitals, radiology, diagnostic imaging centers, standalone. It's been the public hospitals throughout Africa. And here it was ensuring the business continuity for those customers. It was ensuring that the workflows and the protocol in a situation of emergency were met. For us, it meant, people, making sure that we put in the forefront our staff, technical staff, clinical staff, and the back offices. It's also about supply chain. We'll talk about that, I'm sure, during the session more, but supply chain has been a huge challenge globally, and specifically with regards to healthcare, and I'll touch on that later on. And then once again, how are the sites ready? When you go to a hospital in an ICU ward and you've got your own employees, you've got your customer employees in these rooms in a situation of pandemic, how do you react? So that's been a big challenge for us. And I'm proud to say that, from across the continent, I think about the examples of how our teams, whether it's in Algeria or Tunisia at the very beginning of the pandemic, went to clusters and delivered ventilators. You mentioned ventilators, Babatunde. We had to ensure that ICU beds were well equipped. An ICU bed is not just a bed. It's everything that goes around to make sure that we can support patients in distress. And that means monitors need to be on, ventilators need to be on, anesthesia machine needs to be on and need to be working properly. And you need people to be behind that and ensure that. There are also different forms. We're an infrastructure company, but when we were faced with the challenge, we had to be innovative. And I think about what we've done in Nigeria, for instance, assisting the Nigerian governments through the National COVID Task Force hotline. We've got within our service and maintenance infrastructure hotlines and call centers. So what could we do with these call centers to support the surge in calls, just hotlines that were in different countries? And we did that in Nigeria with a fantastic, I would say, public-private partnership, which is quite unexpected in that form, but it worked well. And I'm quite proud of the team and that supported that. I touched on supply chain. Globally, we had to really up our game in terms of supplying critical equipment. We talked a lot about ventilators, but it was also about ultrasound units. It was about CT scans and X-ray machines, patient monitoring, all of that from a capacity that was set at a certain level in normal time had to be multiplied by many folds in a very short period of time. And this is where thinking in terms of how you flex your capacity, not only your manufacturing capacity globally, but also the capacity of your supply chain. When you are a manufacturer like GE, and there are many others that have contributed to that fantastic effort, you need to ensure that all the components come at the right time so that you can manufacture, you can ship, you can deliver, you can install. And I think that's a big learning for all of us on how we expanded our capacity overnight. We tend to forget as well that a lot of procedures, and Babatunde touched on some of the figures and the disease burden, the affections we have in Africa, and the little capacity we have both in terms of clinical, human capital, and infrastructure. But we had to continue also supporting what we call the elective procedures. All of a sudden, people were scared to go to hospitals, to go to diagnostic imaging centers, to do a CT scan, to do an MR, or to have a surgery. Well, when there are cases of cancers and diagnosis that you cannot delay, you have to ensure that those infrastructure are working. And I think we made a point within GE, because that's part of our mission, to support that part of the sanitary priority. And we even went to the point of continuing working on important projects like, and I'm sure you've seen that in the news, continuing to develop, building projects like the molecular imaging and cancer center at Kenyatta Hospital in Kenya that we announced a few days back. That's the kind of things that need to go on. To Babatunde's point, it's about planning long-term sustainable response to something that can hit us tomorrow. And we know that non-communicable diseases are hitting us slowly and silently in the continent in Africa today. I touched on, the many instances where we've seen our frontliners and particularly the field engineers. We talked about infrastructure, but infrastructure works only if you have engineers and field engineers that are trained, that are available, that can go and support that infrastructure. It's not about procuring equipment. Claire, you know that as much as I do. It's about making that this equipment is the right equipment for the infrastructure, and it works for the many decades to come, not just 3 months, and that you have localized workforce in Africa that are experts and that can deliver the services over time and make it sustainable. And COVID was a good test for that. I can share with you, within my team in Africa, we didn't have to fly any specialist expert from outside, neither from Europe nor the US. We couldn't anyway, but we have built over time teams of experts in all these modalities and equipment and infrastructure. And I was so proud to see that our born Africans could deliver that service overnight in an amazing dedication throughout the continent. So that's also a learning. Make sure that your human capital is localized, is there, because in times of the likes of COVID, you have to respond very, very fast. The last point I made, Claire, is maybe how a pandemic like this is an opportunity for us to innovate. And I think when we look around the what we had to do and reinvent ourselves, and particularly realizing the importance of acting remotely. When there is a site where you have a high level of contamination, you have to continue providing your services remotely. And the digital solutions that we had tested for years had been applied to really enable remote work, workflow adoptions that were not the typical workflow, safety workflows where the staff in hospital had to adapt to. And we have seen, we've heard hospital CEOs and managers saying that digital actually has progressed more in the past few months than it has over the last several years. And patients, demand more telehealth, and it happened in Africa as well. It's not just something that, happened in Europe or the US or in Asia. It happened actually in our continent. And we've got a lot of examples through our own activities where we provided training remotely and digitally to clinical staff in ICU rooms. We were able to augment the capacity through digital and remote actions. And we've done that, across the continent in many countries. And I truly believe that we're going to see an acceleration of very affordable, simple, digital and remote support solution for clinical staff, for technical staff. We did remote fix of our equipment on service and maintenance because we could not simply go on site. So we had to fix CTs and MRs and X-ray machines remotely, digitally, and it works. So this is all food for thoughts for all of us in this room. I'd just like to finish on what Babatunde said. I'm glad to have seen the multilateral organization like the African Development Bank, like the World Bank, getting into what I would call the smarter way of procuring. That emergency has made us realize that, when you've got a few thousand working ventilators in a continent of 1.3 billion people, you've got an issue in planning. And that is the task to all of us to come together, public, multilateral, private. We have the solutions. We just need to be smarter at doing this, proactively and not waiting for a crisis to hit. So that would be my last words, Claire. Back to you.
Thank you very much, Farid, for sharing, most importantly, what GE has done to build resilience internally, looking after her immediate customer, who is your staff, and then taking and transposing innovation to be able to make solutions for Africa. There are two watchwords which you shared, and I'd like to just emphasize, and the way you ended your conversation, that you think that the pandemic will provide an opportunity for innovation, but also that digital strategy, which Africa, as you have said, has really benefited from, but will be able to provide affordable, long-term digital solutions. In Africa, that word affordability remains a very important word for access to quality healthcare. Thank you, Farid, for sharing your thoughts on this area and the innovations that you're doing. We'll now move on to our next speaker, who is the Managing Director of Linné Middle East and Africa, Jitka Stranska. She has been the MD since 2019, and Linné Middle East and Africa is part of the Linné Group. She works out of Dubai, and she's responsible for the overall performance and support of Linné partners in the Middle East and the African region, as well as Turkey and the Indian subcontinent. She holds regular active participation with professional conferences and congresses, and she's very interested in making sure she supports her customers with both pre-sales and after-sales clinical training courses. Farid said that an ICU is not just a bed. I know we're going to hear from Jitka to tell you how important the bed is, but also to the fact that it is about partnership and an entire system. That one piece of equipment doesn't make it happen. You need equipment, you need people, and you need infrastructure. So I'll let Jitka tell us a little bit about what Linné has been doing, and also how important your role is and has been in the fight against COVID in this present pandemic. Jitka?
Thank you very much, Claire.
Jitka, over to you.
Thank you very much, Claire. Good afternoon, everyone, and thanks for having me and Lynette in this online session. I'm really very sorry that you cannot see me, because I just experienced that to run the video with the audio together, I obviously do not have a proper quality of the connection, so sorry for that. Well, we have started with short movie showing Lynette's high-end product segment of lateral tiltable ICU beds, which are currently serving COVID patients and supporting healthcare system in fight against coronavirus worldwide. Since you can switch to the next. And the next one. Basically, since February 2020, we are all witnessing extremely increased demand on disposables, ventilators, and patient beds, especially ICU beds. Different countries were obviously differently prepared or unprepared for such pandemic situation and took different measures to deal with the unprecedented situation. There are specialized facilities popping up where quite big numbers of general beds had been needed and requested, and there was in majority of the countries lack on ICU beds identified. As when it comes to COVID patients with the acute respiratory distress syndrome, and basically where general beds will not be sufficient in majority of the cases, we are serving our patients with the proper ICU equipment. COVID patients with ARDS need mechanical ventilation, which is life-saving on the one hand. However, it causes in many cases further respiratory complications. To deal with those, oftentimes patients is going to be turned to so-called prone position, which means patients lying face down. And this position is beneficial for the lungs, definitely, but it can cause facial edema, difficulties with enteral feeding, accidental extubation, vascular and nerve compressions, and many others, and many other complications, which might definitely lead to further complications in the healing process and unnecessary extensions of patient stay on the ICU, which we all know that it's connected with high costs. Beside that, it's very demanding for the caregivers and time consuming for the nurses to turn the patient into that desired position. And therefore, Lynette recommends and offers lateral tiltable ICU beds to turn the patient effortlessly, let's say, in a desired positions, and to move patient on a regular base to a proper position for proper and more efficient lung performance. But we definitely know, and we are aware about the fact that not each hospital can afford this high level of ICU beds due to limited budgets. And the economic impact of the pandemic will definitely not help in this situation. Therefore, we come up and offer a wide range of patient beds, starting from mechanical ones, going to the range which you could see on the movie, on the introductional movie. Through proper analysis and deep analysis of the needs in each and every hospital, we are able to customize an individual product mix to make sure that the hospitals achieve the best, let's say, price performance ratio, considering the available budget. In the same time, we encourage everyone who is involved in the decision-making process to consider the long-term perspective and bigger picture of the current purchases. My last speech within Africa Health Symposium in Addis last year was about safety and how 20 till 40% of health spending might be wasted due to poor quality of care, poor quality of equipment, and safety failures. So we need to make sure that that talking about the budgets and costs doesn't mean only considering of the purchase price. The choice of the equipment has huge impact on the further and future spendings in the particular hospital. Choosing patient bed today means making choice for, in optimal case, of course, 12 till 15 years. So even though the budget is maybe limited, don't go for the cheapest available product. Rather ask us to work out together with you, of course, the suitable product package, some maybe frame contract where we can together prioritize and release the most critical goods first and continue with the others. or reach out to us, ask for financing possibilities, which a company of our size is definitely ready and able to do. Or maybe let's consider, instead of immediate purchasing, some kind of renting concepts of the more expensive ICU beds if they are at the moment not affordable for you. The next slide, please. Let us also have a look in other challenges which we were witnessing in the last months. It was more or less all about fast availability. Oftentimes in this scenario, we saw that immediate deliveries were above all other parameters. There was literally no time for focusing on quality, durability, sustainability, or something we call total cost of ownership, which means the product including all follow-up costs connected with the product during the complete life cycle. There was oftentimes no possibility to evaluate if the product is supplied through trustful partner. So the question is, if you prefer to go for immediately available patient bed for maybe not that well-established supplier, neglecting safety, durability, or the features which the caregivers will be working with on a daily basis for quite a long time, or if you maybe have the possibility to split the deliveries in some phases and prioritize to get step-by-step absolutely sustainable solution, you will be satisfied with over the upcoming 10, 12, 15 years. And last but not least, I would like to mention other challenges which we were facing in the last months, and it was the challenge of our clients to deal with absolutely with the new situation, which we were all challenged with, and with the new equipment they were receiving. So what you usually receive with high quality products such as ours is the full service, including proper training, clinical and technical support. As currently we are all not able to travel as we are used to do that or visit the hospitals due to several restrictions, we have as responsible manufacturer to adapt on this situation and invented online courses, online trainings and sessions, and specific remote after-sales support to make sure that you are not alone with our product, but that you receive the full service like you would do under the absolutely normal circumstances. So,
thank you.
Yeah, so as you can see, we are really doing our best among the responsible manufacturer to adapt on the current challenges, and are very much ready to support our clients during these difficult times to continue sustainably increase the quality and safety in the hospitals. So let us become partners in that, and I'm sure you will be benefiting from that during the pandemic time and definitely beyond.
Thank you very much, Jidka, for that presentation and telling us and sharing with us the experience of the Linné Group on some of the products that you do. A couple of words that you mentioned, that don't buy cheap. I think we've learned the lesson, especially on COVID, that cheap is not great. And when we come to the word ICU, those two words don't go together. I think one of the most expensive places outside radiology or radiotherapy in a hospital really is the intensive care unit, because of the amount of equipment that goes around one bed. And beyond equipment, I always want to emphasize that an ICU is also the skill sets of the people. It's one-on-one nursing care. And therefore you need to be able to be highly skilled, highly trained, and have a focus on quality, as you say, and safety. So it is not the place to cut corners. You will agree with me that there's been a lot of equipment dumping on our continent of substandard beds and ventilators. And it is unfortunate that standards are not or have not been upheld during COVID. But I'm sure in the questions and answers, we're going to come to that issue about standards and how do we emphasize quality over cost, and how do we help support procurement people on making a wise choice that cannot just be based on cost. I think it's very important. So don't buy cheap, buy quality, buy the total cost of ownership. Those are some of the words that Jitka has shared with us today. Thank you for that. Now we'll move on to our last and very special speaker. And this is a pleasure for me to introduce Dr. Steve Adudance, who is the CEO of Mediquip. Let me just pull up his, just a little bit more about him beyond what is on the screen. So Dr. Steve Adudance, or Dr. Steve for short, is a Kenyan-born, UK-trained public health and infectious disease specialist with over 10 years of global experience. He received his undergraduate medical degree from the University of Nairobi in Kenya and his postgraduate training in infectious diseases, which is very pertinent right now, at the University of London, London School of Hygiene and Tropical Medicine. He is the executive director of the Center for Public Health and Development, as well as the CEO of Hewatele and the Mediquip Global. Hewatele runs 3 oxygen plants in Kenya, serving over 10 million people with affordable and quality oxygen. And I'm sure you all agree with me right now that the most important commodity beyond a mask is actually oxygen, and oxygen is now equivalent to gold. So we're speaking to probably a very rich man, Dr. Steve. I'll give the floor to you to please give your presentation and share what your company, Mediquip, as well as your other companies have been doing in the fight against COVID-19 as an infectious disease expert. Thank you.
Thank you so much, Claire, for the introduction. And I think we've had quite a rich conversation from the other speakers, just laying the background about some of the things that have made health infrastructure, especially in sub-Saharan Africa, be so vulnerable, especially with COVID. And Mediquip Global believes that the heartbeat of every medical device has to be maintained for us to be able to save as many patients as possible. And when you look at the response to COVID right now, medical devices are forming center stage, from oxygen generation to intensive care. And Mediquip Global is part of a multi-country, multi-agency, and multidisciplinary group called the NEST 360, which is an acronym that stands for Newborn Essential Solutions and Technologies. And it looks at how do we have a hybrid approach where you have a public health implementation science approach and coupled with business, sustainable business model approach, where you test the devices and ensure these devices are able to be maintained and save as many lives as possible. But what is driving the initiative, if you may ask? At least more than 2 million babies die, and 1 million of this are in sub-Saharan Africa especially. And the conditions that cause these babies to die, especially in the first 30 days of life, are prematurity, infection, and injury to the brain for the babies. Over 70% of these conditions are preventable. And they're preventable using not only just essential newborn interventions, but also technology. And therefore, this initiative focuses on how do we optimize technology, affordable, effective, and robust technology to ensure that we're able to save as many babies as possible. But now we are presented with COVID, where technology is very, very critical in ensuring as many patients as possible are supposed to access most affordable, robust, and effective technology. Next slide, please. Now, traditionally, we've seen what Claire, you just mentioned, that equipment can be dumped into the continent. And this is a picture borrowed from one of our facilities in Malawi, where this equipment, their heartbeat is gone. the equipment are dead. And sadly so is what we refer then therefore as an equipment morgue or mortuary. And it's not something that we want to continue to happen in sub-Saharan Africa. So how do we ensure that the more than at least 70% of equipment that facilities in public facilities in Africa break down within a year? So how do we ensure that there is good procurement, there is a good transfer of education or skills, and good maintenance of the devices to save as many lives as possible? Next slide. So therefore, the NEST group, or the NEST 360, which is a program that, like I mentioned before, focuses on two-prong approach, where there is a focus on implementation science and also sustainable business model approach. There is a concentration on how do we harness innovation within the continent to ensure that there is devices that can save as many lives as possible is developed, tested in Africa for Africa. And how do we transfer skills through an effective education program for clinical users and also biomedical engineers and technicians? And also, how do we learn from that which we implement so that we can have a template that can be rapidly scaled up in other parts of the continent? And through this approach, we are doing this in Malawi, in Tanzania, in Kenya, and in Nigeria, so that we can be able to test and domesticate an initiative that is able to actually ensure that technology is deployed in an effective manner. Next slide, please. So the end result for us is to have effective, affordable, and sustainable deployment system for medical devices. And our focus right now is actually to reduce newborn mortality in our facilities by at least 50%. But COVID has come at a time that we actually had to think very fast on our feet. And you shall see in the next slide that the equipment that we are looking at is actually equipment that can also be used in a COVID situation. And this has caused us to be able to look at how do we ensure that COVID also benefits from this wonderful initiative, and through our partners globally and domestically, the governments that we work with, we're able to increase access to these devices. As you can see there, it's just a paradigm shift thinking. How do we have equipment that actually is robust for our setting, that it will give us the best results for the environment that we work in sub-Saharan Africa? And from phototherapy machine to bubble CPAP to pulse oximeters, these are devices that are essentially basic. And if you look at even the bundle for COVID here, we're looking at an oxygen concentrator, a flow splitter, and a pulse oximeter. These are devices that would make it very easy to manage a patient who has COVID before one is taken for intensive care. And these devices are readily available and can be made available through a global distributor called Hatch Technologies. And if you go to the next slide, just to show the relationship where we have an end-to-end relationship, especially for in Kenya, where we are working to ensure that we have these devices be available at all levels of care, is we have the NEST 360 global partnership, where there is testing of these devices and looking at all aspects of health care system, and looking at how these devices can be integrated domestically into the different countries. And then Hatch Technologies then therefore aggregates the demands and ensures that there's negotiation between the different manufacturers to ensure that there is a good and a flawless streaming of devices to the local distributors. So Medicare Global is proud to be part of this initiative, and currently is already sourcing medical devices and supplies to respond to the COVID situation as part of the Nest 360 program. And this equipment is brought to these facilities at a very affordable rate and maintained to ensure that the heartbeat of these medical devices ensures that the heartbeat of patients continues. Next slide, please. Now, I think it is very important to know that just like every patient deserves to have the best shot in surviving every medical condition, then therefore we have to ensure that we get the best medical devices that are robust, are affordable, and are effective to ensure that we save the lives of many people as possible, especially during this time of COVID, when there is need to deploy effective technology for the patients who are being admitted in our facilities. Next slide, please. So just to thank everybody who has who has made it on this platform, and to ask that we also do have global public goods on the website for Nest 360, and these are like training material for clinicians and for biomedical technicians on the equipment that we're looking at, and this is available for everyone. And also any queries, we can respond to them. Thank you, Claire, and over to you.
Thank you very much, Dr. Steve Dadudans, for kind of wrapping up everything we've discussed today on this webinar. Most importantly, for bringing it home. I think for those of us that live in Africa and are African, we know that children are very important to us. And, as COVID is going on, lives are being born every day. And unfortunately, we have some of the worst stats globally when it comes to neonatal mortality, when it comes to maternal mortality and under 5 mortality. So thank you for sharing with us the fact that we still needed to think about a NICU, neonatal intensive care unit. We needed to still look after those little ones, and that it's through, again, innovative thinking, through private partnerships, again, that now became a public-private partnership, that we can be able to deliver care. I also like what you talked about in terms of, and I couldn't agree with you more, wearing my normal hat day to day, of the importance of maintenance. The picture you showed us of the graveyard of oxygen concentrators looks very familiar. And if I may say so, I don't even need to win a bet, because I'm 100% sure I would win it, that every single teaching hospital on the African continent, you will find at least 4 ventilators, 4 incubators that are not working, that are just sitting in a corner, huddled there, because they bought the equipment without after-sales service. So it's one thing for Professor Amilore to be able to finance infrastructure. It's another thing for Farid to be able to manufacture the great equipment. It's another thing for each and every one of us to buy the right beds. And then for you also to have the equipment. But it's a different thing altogether when it leaves your hands and it gets to the client. And we have a collective responsibility of making sure that we don't just buy equipment, but we buy a service. And I think that's what I've heard resonating throughout our conversations today, that it's important that we have the infrastructure preparedness for emergencies and generally, but we do need to make sure that we buy the total cost of ownership. And maybe we need to look at the way things are procured. So I have a lot of questions right now. Our time is far spent. We have just 20 minutes. I'm going to try and see how we get through this huge barrage of questions that have come in, and I'm going to try and take them each one by one. So what I will do is I'll take a couple of questions per speaker, and then there'll be a few general questions, which any of you may decide to answer, if that's okay. So I will start first with Professor Omilola. In your conversation, you shared quite a lot of points as to what the African Development Bank is doing. You also talked about the committee that you have set up. I've written it down here, let me just find, yes. There's a committee that you've set up specifically to be able to ramp up diagnostic testing. And you also talked about the health infrastructure strategy that your bank is working on that should be out at the end of the year. My first question to you is that, do you have private sector players in your development of that strategy? And if so, is there room for some of the healthcare federations across the continent to be able to have a seat at the table, providing some voice to that strategy? Professor Milola?
Thank you very much, Madam Omatsaye, for that wonderful question. Basically, for us at the African Development Bank, we know that we can only do anything that we want to do by working with our partners, especially when it comes to developing strategies. For those who have been following the trajectory of the bank has what we call the I-5. For those I-5, one of them is to really light up and power Africa, the other one to integrate Africa, the other one to feed Africa, and the other one to improve the quality of life of people in Africa. It is within that improving the quality of life of people in Africa that we are actually crafting a healthcare infrastructure strategy that can really be very useful to look at the healthcare system on the continent and to see how different partners can contribute. So in terms of your question, basically there will be opportunities for a lot of our partners to contribute to the development of this particular strategy. What we are doing right now is at a stage where we are going to be working on the first draft of this particular strategy. And we're actually working, we will be working with a private sector entity to really help us to produce that first draft of the strategy. Once that is done, we are going to have several stages of peer review mechanism of this particular strategy, which will involve a lot of healthcare colleagues, particularly those in the private sector, including those within the healthcare federations of the African Health Business Federation, so that they can also have their input and contribute to the development of the strategy. So that's how we are approaching it. Separately, I will be engaging directly with Professor Taka and his team to see how they can also really come on board in terms of helping us to make sure that we all jointly work together and shape this healthcare infrastructure strategy that will really be very useful for us to design our new programs and interventions in the healthcare sector. Just to also mention that one of the things that we're doing at the bank is to extend support to what we call non-sovereign operations. Those non-sovereign operations are basically private sector operations in the health sector. Just February this year, the board of the bank approved a $10 million bank equity investment to support Razorite healthcare support in South Africa to really create some healthcare infrastructure for the continent as a whole. So we'll be doing more of that, but we need a really very solid healthcare infrastructure strategy that will help us and guide us in terms of our operations in the private sector. Thank you so much.
Thank you, Prof. Just as a follow-on to what you have just said, you mentioned in your presentation that there's a private sector fund of $115 million. A question to you is, how has the uptake been? And are you able to hedge in local currency? Because most of the African countries, especially Nigeria, where I sit, have had a major devaluation of the local currency, and people are now a little bit apprehensive about buying and borrowing in US dollars. So is the loans or the interventions that you're doing, are you able to hedge in local currency, and what has the uptake been?
Thank you so much for that question. Let me mention that the $115 million that I talked about is coming from our African Development Fund instrument, which is basically an instrument that provides concessional finance for our low-income countries. The $115 million is going to be in form of grant, all of it, grant, not loan. And what we are doing with that is basically to support our regional economic communities, and I've mentioned them earlier on, across all the main regions of the continent where we have low-income countries, in East Africa, in Southern Africa, in Central Africa, as well as, of course, in West Africa. So basically, what that resources will be doing for them will be to support areas around cross-border interventions, contact tracing, purchase of necessary equipment and healthcare infrastructure to really help to deal with the pandemic. And for some of these regional economic communities, they will be working closely with the World Health Organization. The World Health Organization will be the core, the key implementing agency for them in terms of the procurement that need to be done, but also in terms of capacity building and human resource training that are required to really deal with the pandemic. In addition to these regional economic communities, there are a few countries that we have also selected that are benefiting from this ADF instrument of the bank. And these include Zimbabwe, which we have extended $13 million grant to them. Also to South Sudan, that got around $4 million in terms of grant for South Sudan to really deal with the pandemic. So we, of course, take note of local currency situation. The bank operates in different currencies. For instance, at the bank, we use what we call the unit of account. From there, of course, you can derive our US dollars, and then we really take charge when it comes to understanding the local currency situation and depreciation that many countries are witnessing. So all of these things are taken care of at the level of the bank. So those are some of the grants that we're extending to countries, especially low-income countries and countries in fragile situation, so that they can really be able to deal with the pandemic. And the $115 calculation is actually separate from the $10 billion dedicated resources for COVID-19 crisis response facility of the bank, which of course we have been preparing several operations for several countries, for Nigeria, for Mauritius, for Kenya, for Morocco, throughout the continent. So to really support them, provide the necessary liquidity that all of these countries require. For instance, recently we approved for Kenya, I think around $288 million, equivalent also for South Africa, just before our board went on recess. Around also $288 million was extended to South Africa, which is part of the $10 billion COVID response facility that I mentioned earlier on. So, of course, in all of this, we take care of the currency situation. Thank you.
Thank you. There's one other question, but I'm just going to ask you just to make it very short. The client or the person says that prior to COVID-19, many African countries already had huge infrastructural deficits. And as a developmental finance institution, you have a very important role to play in policy formulation or influencing policy. As you know, the Abuja Declaration was signed many years ago that healthcare budget should be 15% of the national budget. Is there anything that the African Development Bank is doing to make sure that in addition to the loans and the grants that you're providing, that African governments do, start to dedicate more of their capital expenditure and general budgetary allocations to healthcare? Just 1 minute on this.
Thank you very much. A very good question. Actually, one of the things we are doing at the bank is really to support in terms of knowledge dissemination. We have just completed a study, which we call the Guide on Value for Money in the Health Sector in Africa. We will launch it also before the end of the year. What that is saying is to basically look at resource efficiency in terms of budgetary expenditure in the health sector. We are very well aware of the 15% budgetary allocation that are required for African countries in the health sector. And that particular guide will really show African countries how to get it done. And we have also conducted a lot of trainings, a lot of capacity building efforts of senior staff across many African governments to really understand about budgetary allocation in the health sector and what to do to have efficiency in resource allocation and in everything that they do. Basically, we believe that this is the way to go, especially if we really want to close the $66 billion health financing gap on the continent. So we're doing a lot of this, and we have also produced another work, which is a really very good one, which is titled Public-Private Partnerships for Achieving Universal Health Coverage in Africa. This also will be launched this year. This is also as a way of setting policy tone, as a way of policy formulation for African countries to see. So in addition to financing, We do a lot of work in terms of policy processes, in terms of capacity building, but also in terms of knowledge work on what countries can do to really support them in addressing earth infrastructure gap, but also addressing the earth financing gap on the continent. Thank you.
Thank you very much, Prof. Thank you very much for those for all this very, very informative.
Thank you.
Concerns about the level of quality equipment that has been brought to Africa. A lot of it is substandard, sometimes hazardous. What do you think that OEMs and OEM partners should do to influence having standards for importation or use of equipment in African countries? Farid?
Okay, so sorry, Claire, we lost you for a while, so I didn't know the question was to me, but yeah, I think the question of quality and sustainability of the equipment and the infrastructure is key. And I think we've been long enough on the continent walking the corridors of, you know, public and hospitals or from healthcare providers to understand that the worst thing that can happen is to have equipment sitting there idle, not maintained or not used, and not delivering the service to the patient. So I think there is indeed a great effort to harmonize, could be done at the could be done at the Africa Union level in terms of harmonizing the regulation with regards to both the standards of quality from a regulatory standpoint for equipment, and also the governance. You know, how do you manage that at country level? What is authorized? I think a big debate around healthcare equipment, and particularly technologies that involve a certain level of risk and clinical risk. This applies to both pharmaceutical, but also, you know, med tech equipment. We know that in our space, radio protection is a key issue, and we've been trying with some of our partners to enhance the level of understanding of the radio protection risks and what needs to be done from a safety standpoint. So I still see, to be honest with you, I still see, unfortunately, you know, equipment substandard being imported on the continent that one are second-hand, third-hand equipment from, you know, the US or from Europe or other parts of the world, imported in, I would say, unprepared manner. And these equipment do imply risks to patients or risk in delivering quality healthcare. And I think that's something we need absolutely to regulate better on the continent. The OEMs have a responsibility in that, but I would say, I'll share with you an anecdote. You know, although what we import as GE, we know what we import, and we have an obligation because we have the brand on this equipment to look after our equipment and make sure that they deliver what they're supposed to be delivered and serviced and maintained. But I do see some of the equipments, all of a sudden somebody would call me and say, hey, you know, I have an equipment, a GE X-ray or a GE CT scan, and I need you to fix it because it's not working. And guess what? We didn't import that equipment. That equipment landed out of the blue on the continent, bought on, you know, second-hand markets throughout the world. And that's something we absolutely need to regulate better. So I think we have our responsibility at OEM, and I've been taking that responsibility since I've set foot on the continent. And but we need also the authorities to put the right regulation to prevent this situation happening. And we can collaborate on that. I think there is a lot of room for us to sit down, set up the work together on what are the standards of quality, safety, and governance.
Thank you, Farid. Just one more question for you, and that really is that a lot of the speakers today have said that pandemic, in a way, although it's a mixed blessing. So for every time there's a challenge, there's also an opportunity. So from your perspective, also as an investor in Africa in this space, how do you think we should be able to leverage on this pandemic to be able to get better infrastructure and facilities for Africa with access to quality health?
Well, I think one of the most efficient way to do that, and we've been, wishing to do that for many years. And I'll go back to what Babatunde said, because I think the multilateral organization like the African Development Bank, some of the government agencies helping Africa, you've got billions of dollars of programs to Africa on health and health infrastructure. The key is, how are these dollars used? And how are these dollars really invested to deliver long-term sustainable healthcare outcomes? And that's where we need to do definitely a better job. I think an African Development Bank or World Bank or an IFC and some other government agencies can bring the capital. I think we had good example of grant, development funding, SME funding. I know there was a lot of questions here from participants on SME funding. You raised the cross-border foreign exchange risks that we need to mitigate. So we've got the tools. I think where there is a big gap still today is, how do you execute? How do you execute? So on the one side, there is the likes of the company I lead for Africa, GE, and some others. There are many others. I think we got some great example today that are ready to do the right thing, execute at the right standards, co-invest in some instances, really share the risk. We have localized workforce and expertise to deliver on those. I think, how do we connect the capital on one side and that capabilities of execution on the other side? I know there are a lot of taboo around procurement, around being able to be fair and equitable in the way we work with private partners. But at the end of the day, you don't procure a project. You don't procure, a co-creation. A lot of that is having stakeholders sitting around the table and saying, what is the goal? What is the goal we set for ourselves? And what are the best stakeholders to really contribute to executing this? And then, people come to the party and say, I can do that. That's how much I can participate to. And I think if we do that, we're going to really optimize the $1 billion that go to health in Africa every year from all these agencies and government budgets.
Thank you very much. Thank you for those words of wisdom. And also shows the years of experience in this field. And I see your finance cap coming out very clearly and governance. So we'll now move on to Dr. Steve. Just two quick questions for you. The first one is really about a question mark to what's going on in Africa right now. I think the world predicted a lot more fatalities on the African continent, and somehow there are not as many, really bad cases of COVID. There are a lot of cases, but not really needing intensive care. As an infectious disease specialist, what do you think is responsible for this? That's the first question. The second question is really around business. You are a multiple or serial entrepreneur, if I may say so. So how would you advise an African startup to build a very strong ecosystem and then be able to go from a small to a large, like we've heard many of you here today, a corporate?
Yeah, thank you, Claire. I think very, very good questions. For the first question is, Africa was seen to be one of those continents where the full, blow of COVID would take center stage. However, this has not been as what was simulated, and to a bigger extent, as all infections, usually there are certain elements that that affect the spread of a disease, especially an infectious agent, like now corona, and that is usually the host and the environment. So Africa presents a very, very unique environment, possibly at the time of COVID, where we're looking at a very warm temperature area, and therefore COVID as a virus would take a bit of time to be able to be spread as compared to the other countries. But then also we should look at the level of pollution. So certain elements of pollution also make it very, very easy to have a very easy environment to pass on the virus. But I will not forget also that the testing capability of most of the African states has slagged on to a greater extent, and therefore we are likely to have had a lot more cases that went unreported, because the symptomatology of COVID is that one can have a symptomatic state to a very, very symptomatic state where one even requires ventilation. So there is that component that contributes to a far large extent, and therefore just increasing the capacity to be able to test as many people as possible ensures that we are able to stem the spread of the virus to many people, especially so in Africa. And we've seen also the demographic structure. If you look at the percentage of people who are under the age of 30, all over the world, Africa seems to have quite a large, almost 60% of sub-Saharan Africa population is a youthful population. If you compare that to European counterparts, then you actually see that the demographic structure also contributed a lot to some of those countries in the West facing the brunt of COVID. So those are some of the elements that I would see as some of the reasons that would show that Africa has maybe understated. Now I know we need to move, but for startups, yes, I'm seeing the time there. I think for startups, to a greater extent, there is the incubation partners who are able to link with the networks of entrepreneurs. So we are happy to be able to communicate on some of those incubation hubs, and East Africa, as you know, in Kenya and also in Nigeria. Those incubation hubs really help to build startups so that they're able to get the expertise that they can get remotely or on site to be able to grow. Let me leave you that over to you, Claire.
Thank you very much. And I have left the best to last, should I say. So this question now is really on the system here. It says, can one of the panelists address the issue of vaccine, therapeutics, diagnostics, manufacturing on the continent? The pandemic has exposed a serious vulnerability in this regard. So thus far, we've been talking about importation of X-rays and CTs and beds. Is she still on the line? I hope she's still on the line. Can we get, the last but not the least, can we get Lene to answer the question? Would you consider manufacturing on site on continent?
Hi, Claire. Yes, I'm still online.
Chica, okay.
And basically, yes, we were considering this several times.
Okay.
So,
And what would it take? Or let me rephrase it. What would it take to get more investment in manufacturing on the continent to make Africa, sustainable rather than being import dependent? If I use my country, for example, 70% of our drugs are imported from India and China. Over 99% of our equipment is imported from all over the world. So what would it take as an OEM to actually either do some backward integration or some partnerships with people to have a factory on continent?
Okay, so basically it's a good point and good topic. I don't know if we will be able to manage it within
just a few highlights. What would it take for you to make that kind of decision as the MD?
Yeah, sure. So we were really considering that several times based on some even requirements coming from different countries. So it's a live topic and repeating topic basically on our desk. We think that to invest in some local assembly will be great, or some local partnership with some company or government either would be great. The only thing is we definitely need to consider the effectiveness of that. Because I was talking a lot and highlighting a lot the quality. And the quality is main actually parameter of Linac products. And we are very proud to have one production facility back in Czech Republic where we have like 100% control over the quality. So to be able to relocate or redirect some of the responsibilities to African or any other country would need really a deep analysis, how much deep into the product we can go, how much deep into the assembly we can go to still make sure that the quality is really 100%. So this will be the first thing. And the second thing is definitely it makes it worthwhile in case we are able to generate in a local assembly or local manufacture a certain quantities of the beds. So it doesn't make sense to make it, let's say, one-shot project.
So you need to have economies of scale, an off-taker agreement where you're sure your production will be used on continent.
Absolutely, absolutely.
Okay, all right.
So this is basically it.
So thank you very much. I left the best to last. Usually they say ladies first, but we're talking about equality and equity. So I decided, Jitka, I'd leave you to have the last word. Now, just before we go, I'd like to ask each and every panelist to give a parting shot. Just in 10 seconds, tell us something that you'd like the audience to take home. We'll start with Prof. Prof, can you hear me?
Hello? Yes, I can hear you, Madam Omatse. Thank you so much.
Thank you.
I would just like to thank the organizers, Professor Taka and his team, and every other person that has participated, the fellow panelists, for this great opportunity. I think for me to conclude, let me say that there is no time to waste at all. While we continue to find ways to battle the current pandemic, we must also use this as an opportunity to strengthen the Africa Health system, particularly in terms of Africa Health infrastructure. And we need to do this by following a very comprehensive and integrated approach based on each country's needs and requirements across the continent. After this pandemic, we must not return to the business as usual. Thank you so much.
Thank you. Farid, parting shots, 30 seconds.
Yeah, just Claire, I will just end on a note of optimism. I would just say I'm much more optimistic because the level of engagement I'm seeing from all the healthcare stakeholders, whether it's OEMs, multilateral governments, is increasing. It has increased. And I think this is a good sign of what can be done together. A lot of stakeholders have localized their capacities, not necessarily manufacturing, but I'm sure it will come, but their capacities in continent. And this is a good omen for the continent and healthcare.
Thank you for the positivity. I mean, you know, we're very positive out here. Can I have Jitka, please?
Of course. So thank you very much really for this amazing work and making this happen. It's a really great opportunity. And I would just, let's say, confirm and sign what Mr. Farid is saying. I also see really a good and positive development in Africa in terms of awareness about the sustainability and investment into the right equipment and products. So let's continue like that all together.
Thank you, Jitka. And finally, Dr. Steve Adudans.
Yeah. Yes, thank you, Claire. I think for me is just to say thank you to the organizers and to say that we need to deliver on our promise for health as a human right for the continent. And this requires that there is domestic and global investment on innovation and also deployment of effective and robust equipment and technology in order that every life is valued and we give the best shot for every patient in the continent to survive. Thank you.
Thank you. So my job is very easy. It's really just to say a very big thank you to, first, of course, our delegates, everybody who has stayed the cause. I know we've overshot the time a little bit, but you'll agree that the conversation was just very interesting. We couldn't really stop it so fast. But just to say a very big thank you to each and every one of you for staying the cause and for listening in. Of course, to our distinguished key speaker and panelists, thank you for sharing your words of wisdom and for ending on with a positive note. I'm going to just do a few highlights, and I just like to take them as tidbits. It says, Prof says it makes sense to invest in quality healthcare infrastructure, both from an economic and social perspective, creating an avenue for a resilient society and growth. The time is now. Let us use this opportunity that we have to make a difference. I heard from all the speakers that we need to be able to use this pandemic opportunity to make a difference, to strengthen the healthcare infrastructure that has been ailing in our economy. We need $66 billion to be able to close that infrastructural divide, but with innovation and innovative financing through strategic public-private partnerships, as we've seen here today, we can truly make the difference. Innovation is the name of the game, and the future is digital. COVID-19 has made most of us change our digital, or if you didn't have a digital strategy, develop a digital strategy. This meeting is a clear example of one. We would have to have traveled somewhere, spend lots of dollars. So some industries are not doing very well, but we can see that we can do a lot more efficiency and leverage the same digital technology to bring it to the average African so they can get access to quality care. The watchwords for us is not just infrastructure, but access to quality and safe and sustainable infrastructure that will stand the test of time, backed up for equipment with after-sale service, with capacity building, clinical training, and in-country support. As Farid says, we cannot depend on having engineers flying in and out. Anybody that wants to work on Africa needs to invest in Africa, in our people. People make it happen. And once we get that, the equipment is just the tool. We need to think about our patients and be patient-centric in everything we need to do. We want to thank the multilateral agency, especially African Development Bank, for their support. The amount of grants and, well, I say corporate social responsibility that have come into the healthcare space. We in healthcare need to make sure that what is procured will stand the test of time. I have a potpourri of stories, but as Farid said, it's important that we end on a positive note. There's all kinds of things that have been dumped on our country. We have a responsibility as the African Healthcare Federation, the African Health Business Symposia, as well as all the federations across Africa, to influence policy, be at the table when policy is being formulated. And we will be coming to you, Prof, to make sure that that strategy document and the policies, as Farid said, are enabling that we do not become a dumping ground for obsolete technology. Our dollars, our local naira, our CFA is very scarce. Where we would sweat an asset for 2-3 years, we have to stretch it for a longer period of time. So we need to buy the right technology for our country that will be able to have sustainability. At the end of the day, It's about strategic partnership. And today, ladies and gentlemen, you will agree with me, we've had a fantastic conversation. And I would just like to say, have a good evening, and please keep safe. Wear your PPE when you go out and social distance. Have a lovely afternoon or evening, depending upon where you are. Thank you.
Thank you.
Your again, innovative thinking, replacing a conference we're supposed to have had with this series of webinars. Each webinar gets better and better, and it's something that I think everybody looks forward to listening to. And the communique that comes out of it, I think we need to be able to make sure governments also hear this. So thank you very much to AHBS, and of course our very important Dr. Amit Thakur. Over to you, Patricia.
Thank you. Thank you, Claire, for taking us through that infrastructure and equipment session. A heartfelt appreciation, and thanks to all our panelists who have taken part in this session. Before we wrap up for the evening, I'd like to show some partner videos. And yes, some partner videos. But before that, we would like to highlight our upcoming webinar. We have our last session coming up, which is financing models, next Friday at 4 to 5:30 East African time. We'll be having Ms. Zola Mitshia from Africa Healthcare Federation as our moderator, and Kamarogo as well. And as Africa determines what lies ahead, the partnerships and collaboration within the health ecosystem must continue. Join us for AHBS, the second webinar series, themed Partnerships for Resilient Health Systems. In this second series, we will reimagine stronger health systems to continue protecting the 1.3 billion lives, as well as determining economic rebound strategies for sustainability in Africa. Thank you, everyone, and have a great evening. Thank you, everyone. Thank you, Claire, and everyone else, and all the panelists.
Thank you, Patricia. Thanks, you, Dr.
Patricia.
Amit Thakur, Liz, Fareed,
Guys.
Prof.